Welcome. My name is Megan. I'm a health coach at Intera Health, and Snack Plate sessions are offered on the fourth Thursday of each month around this lunchtime hour. And really, the intent of these sessions is to just provide a small bite, quote unquote, bite of information on a specific topic. So today's topic is diabetes, and kind of getting a little bit into more about learning about what diabetes is, the different types of diabetes, symptoms that often come with the different types, and we'll go over that, and then how to get tested and how to go through the testing process to determine if you have diabetes. And then we'll talk a little bit about prevention and controlling some symptoms, and I'll leave you with some more educational materials and next steps for the presentation. So let's get into it. So what is diabetes? I'm sure everybody has heard the word diabetes. It kind of is a common illness that people now experience more and more often. So you probably know, you've heard of it. So basically, kind of going into it a little bit more, diabetes is a disease that affects how the body uses glucose. Glucose is a sugar that's in the body's main, the body's main source of fuel. So if you think about it, like a CD player needs batteries, your body needs glucose to keep running. So it works by you eating, so the food you eat, then glucose is made from that food and gets into your bloodstream. From that, your pancreas makes a hormone called insulin, and then the insulin helps the glucose get into the body's cells. So it's kind of like it's a transportation method. Then your body gets the energy it needs from that initial food you ate. So that's kind of the cycle we're working with. The pancreas is a long, flat gland in your belly that helps your body digest food. It also makes insulin. Insulin is a kind of like a key that opens the door to the cells of the body, and it lets the glucose in. Then the glucose can move out of the blood and into the cells. So if someone has diabetes, the body either can't make the insulin, or the insulin doesn't work in the body like it should. The glucose can't get into the cells normally, so then the blood sugar levels get too high. Lots of sugar in the blood can make people sick if they don't get treatment. There are different types of diabetes, so we'll kind of go over what they all are. And the first type, nope, I think I lost you. Okay, the first type is type 1 diabetes. The pancreas can't make insulin. So the body can still get glucose from food, but the glucose can't get into the cells where it's needed, and the glucose stays in the blood. And this makes the blood sugar levels very high. The next type is type 2 diabetes, and type 2 diabetes is different. With type 2, the pancreas still makes insulin, but the insulin doesn't do its job as well in the body. The glucose kind of hangs around and it builds up in the blood, and the pancreas makes even more insulin to kind of get the glucose into the cells, but eventually that effort doesn't work out so well and essentially raises the blood sugar levels in the person's body. The next one is gestational diabetes, and this is diabetes that develops during pregnancy. And then pre-diabetes, before people develop type 2 diabetes, they almost always have pre-diabetes. Blood glucose levels are generally higher than normal, but not yet high enough to be diagnosed with diabetes. This condition puts you at a higher risk for developing type 2 diabetes and cardiovascular disease. There are no clear symptoms for diabetes, so chances are you may not even know you have it, unfortunately. Some people with prediabetes may have some of the symptoms of diabetes or even problems from diabetes already. You usually find out that you have prediabetes when you are tested for diabetes, and we'll talk a little bit about testing. If you have prediabetes, you should be checked for type 2 every 1 to 2 years to kind of gauge where you're at with your blood sugar levels. So what are some symptoms? High blood levels of glucose, blurry vision, fatigue, thirst, frequent urination, sometimes sores that don't heal, nausea, vomiting, weight loss, hunger. These are symptoms that may occur. In some cases, there's not any symptoms at all, so something to consider. Type 2 and type 1 symptoms are very similar, although usually type 1 is often worse in the severity. How is it transmitted? So diabetes is generally transmitted genetically with type 1 prediabetes and gestational due to your genetics. This is why it's important to kind of know your family history for prevention. And then other ways prediabetes, type 2, and gestational can be transmitted is developing poor diet habits or inadequate exercise, which could potentially lead to being overweight, which can increase high blood pressure, high cholesterol, and also, as I mentioned, family history. So those are some symptoms and how it can be transmitted. So testing for diabetes can be done in a few different capacities. The first one is the A1C test. A1C is a test that measures a person's average blood glucose level over the last 2 to 3 months. Hemoglobin is part of the red blood cell that carries oxygen to the cells and sometimes joins with the glucose in the bloodstream. This test is also called the hemoglobin A1C for that reason. This test shows the amount of glucose that sticks to the red blood cell, which is proportional to the amount of glucose in the blood. So if you do have diabetes is diagnosed at an A1C of greater or equal to 6.5%. You can see here. Another test that is done through the BioScreen process through your employer is the fasting plasma glucose test. This test checks your fasting blood glucose levels, meaning that you don't eat or drink anything other than water for 8 to 12 hours. That's one of the reasons why we have you do that. This test is usually done first thing in the morning, and diabetes is diagnosed at a fasting blood glucose of greater or equal to 126 milligrams per deciliter. Some other tests that are done are the oral glucose tolerance test, which is a medical test given you're pretty much is given glucose and kind of seeing how your body metabolizes that and kind of testing your blood after that. And then the other third one that's not on the screen is the random plasma glucose test, and this is similar to the fasting one other than the fact that you don't fast. Okay, so if a few thoughts on prevention and controlling diabetes. You will not develop type 2 diabetes automatically if you have prediabetes. For some people, prediabetes, early treatment and action can actually return blood glucose levels to the normal range. Being overweight raises your risk for type 2 diabetes and heart disease and stroke, and it can also increase the risk of high blood pressure, unhealthy cholesterol levels, and high blood glucose, which is the sugar component. If you are overweight, losing weight may help you prevent and manage these conditions. The good news is that you can lose weight and keep it off even if you've never done it before. The first, step to doing that is to start cutting back on the amount of calories you consume and the types of fats. More important to note is that there is the total fat amount, which can often lead to high calories, but the fats that you want to focus on eating are the healthy fats. So these are the fats that come from unsaturated fats, mono or polyunsaturated, which include omega-3s. Eating less saturated fats can help decrease cholesterol levels. High blood cholesterol is a risk factor for heart disease, and people with diabetes are at risk for heart disease. Limiting your saturated fats can help lower your risk of having a heart attack or stroke. Other tips to make positive impacts to your diet would be to choose foods that are low in sugar and salt, eat foods with more fiber, such as whole grain cereals, breads, crackers, rice, or pasta. Choose foods such as fruits, vegetables, whole grains, breads, and cereals, and low-fat or skim milk and cheeses. Drink water instead of juice and soda. When eating a meal, fill your plate with fruits and vegetables, lean proteins such as beans or chicken, and whole grains such as rice or whole wheat pasta. Losing body fat makes the cell more sensitive to insulin. Exercise is also a great way to improve the sensitivity of the cells to then be transferred into insulin. So since 80% of people with type 2 diabetes are overweight or obese, losing weight and fat through diet and exercise are important components to the treatment of controlling your blood sugar levels. Also, decreasing the risk of cardiovascular diseases can help too. So regular physical activity will help control blood sugar levels and maintain your weight. Exercise allows your body to respond even better to that insulin. So being active and having exercise be an important component to your day-to-day living is a great thing to do, whether or not you are at risk or have diabetes at this point. Try to work up to 150 minutes of brisk exercise throughout your week. Being physically active most days of the week with continuous activities such as walking, using the stairs, moving around throughout your day. Exercises such as swimming, jogging, dancing, strength training like lifting weights and stretching are all great to have into your exercise routine. It can have a very positive impact to your health. Talk to your doctor before starting any exercise program, and be sure to address any changes to your medication before you become active. All right, some other thoughts to kind of keep in mind. If you are diagnosed, please take your medications for diabetes, especially even on those days when you do feel good. Check your feet every day for cuts, blisters, and red spots. To call your doctor if any of those sores don't go away. Brush your teeth and floss every day to keep your mouth, teeth, and gums healthy. If you haven't already, stop smoking. I can't say that enough. And keep track of your blood sugar, making sure you're checking it 1 or more times a day, and your blood pressure. Keep a record of it. So what are the next steps to this? There's some great resources through the Diabetes Organization, American Diabetes Association. It's diabetes.org, and then the American Heart Association is heart.org. Both have excellent resources, excellent recipes, nutrition information, exercise information, anything you really would want from there. Great places to start. Also, talk with your doctor. Go through the testing process. If you did get your BioScreen results back with higher levels on your glucose, be sure to have that conversation with your doctor. It's important to kind of keep that in the forefront of your mind and monitor it. And obviously, too, I do want to mention health coaching is always available to you through Entera Health. So if you are interested in discussing further nutrition or exercise related to diabetes, controlling or preventing diabetes, or any other health or wellness related topic, please feel free to reach out to me. My contact information is on the screen. All right, well, that is all I have for you today. Thank you for joining me in our Snack Bites session. Our next session will be held on the third Thursday of November, since the fourth one will be Thanksgiving. So we'll be meeting on Thursday, November 16th at 11:30 a.m. Central Time, and we'll talk more about exploring prevention. Thank you for joining me today, and we'll talk to you next month.